We love him. He's a great Eagle man. He's a great Philadelphia sportsman. All right, Dr. Salvo. Yo, Doc. How you feeling,
guys,
buddy?
how you doing?
You ready for Sunday?
Ready for Sunday. Yeah, I got to watch it from my couch.
Now, tell me about your family, because I know you do. You got your father, who I love. You got everybody around. What's it going to be like in the Salvo household Sunday?
It's going to be quiet. Dad's going to be, on his couch, and my kids are both in college, so going to be probably relatively low key. And my wife will be looking at me, yelling like a madman. So I think she's going to hang around. I'm not sure.
All right, because not only are you a brilliant doctor, but you bleed green. All right, so God bless you.
Yep. So
let's talk.
Yeah, thanks for having me on today.
Oh man, we love you. And here's the deal. Let's talk about the knee and this injury. And let's do our disclaimer. You are not treating Jalen, but you know everything about the knee from what you read and the injury. Tell us about it, and tell us about how limited he would be.
Right. And I was looking, and again, like you said, I haven't seen him or looked at him or, seen any studies, but from the way he did that, he went into like hyperflexion when he was getting tackled, and then immediately came up with some pain. And, we all saw it, and he went into the medical tent, and that's where you're going to get examined. Their orthopedic doctors are top notch. All their medical staff is top notch. So, they made a determination. I believe they put him in a brace, and he was able to get back in, which is good. That's a good indicator. But still with that, he injured his knee. So it sounds like it was, I was actually doing a little look this morning. I didn't see anything official about what structure. Okay.
Right.
We know it wasn't his ACL, because then you're not back in for that. Most likely it was his medial collateral ligament, or it possibly could have been the meniscus with that kind of injury. But either way, the brace would help stabilize him. That's what leads me to think probably an MCL. So we'll just chat about the ligaments in the knee and what that means for him. So I don't know if this is going to show up here. Let me see if I can get this.
Oh, look at this!
All right, so this is the knee mod.
These props.
Wait,
There you go, right there. Yeah,
I'm twitching a little bit. All right, so this is the kneecap. This is the shin bone.
Yeah.
And this is the medial collateral ligament.
Yeah.
Is right here.
Okay.
That's what this is. And that keeps the knee from going like this, back and forth like that. So that's probably the injury he's dealing with. And there's all kinds of different grades of these injuries. There's, 0, 1, 2, and 3. Grade 3 injuries, and those are really judged off the MRI results. Grade 3 are complete tears. Doubtful it's that. And the key with the medial collateral ligament is when the injuries are in the mid-substance or up off the thigh bone, they have great healing potential. When it's down off the shin bone, those are bad news. So again, unlikely that. It's probably dealing with a grade 1 to grade 2 is what I would suspect. In which case he got treatments all week. They make sure they get all the tissues to calm down. He's probably going to be in a brace just to support that MCL. But as long as he has enough clinical stability, he should be able to get out there and perform. If that's what we're dealing with. And I think that's the most likely event with him.
How does it affect running? So my guess, I gather that you can run straight forward, but it's really the side-to-side stuff that creates the wobble and the instability that would give you trouble.
It's the pivots, right? Yeah. But and also with throwing. Now I believe it's his left knee. Yeah. So that's better for him. It's not his push off. He still needs to land on that.
Yeah.
But I think that's a little better being the left knee as far as throwing. As far as running, that brace is going to give him a lot of support. So he'll probably be comfortable running. Again, that goes by clinically how he progresses through the entire week. And, how he's doing when the athletic trainers are looking at him. They get him on the treadmill, get him on the field and doing some cuts with the brace on, just see how he feels. As long as he's feeling okay, it may bite at him during the game, because it just happened a week ago. That's not uncommon, but I don't think it's going to stop him from playing and performing.
Does it limit what he can do in the run game? Like, because, you know,
well,
you're going to stop like that 40-yard run he had last week. Can he do that?
Yeah, that was amazing. I'm hoping yes. You know, you don't know if that thing's going to bite at you at some point. But if it doesn't bite at him, it's all a matter of how he feels.
Right.
And again, as long as he's clinically stable, that brace will support him. And that should help him a lot with the pain and even pivoting on that side. You know, that's the hope, is that he's going to be able to perform.
Is there anything to do pregame? Like, how do you treat that pregame with the pain? Like, is there medication? Do you shoot, you know, is there,
there are anti-inflammatory medicines and Tylenol. When we were with the Eagles, that was a common thing. They would have, you know, some anti-inflammatory medicines and one Tylenol if they needed it before the game, and that can help. It's not the days, you know, like 10, 15 years ago when people were getting Toradol injections.
I was about to say that, yeah.
You know, before games, that kind of went away, and we found that this other combination of medicines works just as well as the Toradol injections, and I think it's a little less harsh on the kidneys. Okay. So that would be an option, and that's going to be his option. He may not want to take anything.
Yeah, that's wow, that's interesting. You look at it and you go, all right, because he's such a big part of it. If as long as he can plant and, you know, throw, and like you said, I know it's his landing leg, but the fact that you can plant, I think should really help him.
Yes.
Yeah.
Yeah, I agree. And that's a sign that it's if it is the MCL, it's probably a low-grade injury. It's only 1 week from when he did it, so I wouldn't be surprised if it bit at him at some point during the game. I mean, it's not going to be, you know, 8 degrees like it's been the last few days. It's going to be, I think, a high of 40, which that helps a little bit. But still, I mean, he's got some big, fast guys trying to bring him down.
Yep.
So you never know when it might bite at him, but, you know, they're going to be safety first and health first with him.
Sure.
Hey, Doc, with the brace on, can he make it worse?
Only if he does the same kind of the same way he hurt it.
Okay.
So if he gets in that hyperflexion, or if he gets hit from the outside part of the knee, that's what stresses the MCL. So, you know, can he get hurt in an NFC championship game with people all going for it? Yeah. I mean, you know, anybody out there can get hurt, but the brace really decreases the risk of anything more than like it biting at him, but not really changing his healing potential or anything like that.
Doc, great stuff, man. Thank you for your wisdom and your insight. Oh, like we say, buddy, go Birds.
Go Birds.
Enjoy.
We're going to pull it out.
Best of
Have
Dad
fun in New Orleans.
And the Salvo family. We love you, buddy. Thanks, pal.
Yep. Have
Dr.
fun.
Salvo.